Patients can take years to correct their teeth, jaw lines, and even collapse faces, but there's a new method out there that's faster and non-invasive that's changing lives.
It's called Facelift Dentistry, and Dr. Sam Muslin from Facelift Dentistry joins us to talk all about it. Hi, Dr. Muslin.
Hi.
How are
nice
you?
To have you here. Great. Nice to see both
So
of
what
you.
is Facelift Dentistry?
Well, I had to come up with a word, something to describe what I do. And facelift dentistry kind of evolved out of all of the other procedures that didn't work as well. So you could try braces, and a lot of times braces work, but over time things begin to slide. You could try jaw surgery, you can't predict how it's going to heal. You can now have treatment that's done in a matter of a couple of weeks. None of your teeth need to be ground down, no surgery, no braces. It is a revolution in dentistry.
You know, I want to just get to the pictures, because I think the pictures of the befores and afters of your patients really tell that story that you're talking about. Yeah. So if we can start with this woman, so the left obviously is the before, and then the after, you can see the dramatic difference in her jawline. That's from this Facelift Dentistry.
That's from Facelift Dentistry. She has facial collapse just like most patients do in their 50s, 60s, 70s. We're living decades longer. She's experiencing the normal aging process. Her airway's not as big. She doesn't have room for her tongue inside her mouth. The teeth are getting shorter. She's not sleeping as well. There's stress in the system. And so she's able to now get treatment. You can look at this picture on the right. She's biting her teeth together in both pictures. Comfortable on the left, straining on the right, neck pain and all the rest of it because the teeth have pushed the jaw in the wrong position.
So what have you done? We've already gone ahead, but what have you done to make that happen?
What I've done to make that happen, if you look at these patients, what do they need? The number one problem is they don't need bite correction, they need jaw position. The first thing all my patients get is jaw track, jaw positioning.
What does that mean?
What that means is your jaw should be in a certain location, but when you close your teeth together, your jaw is forced into an odd position. You don't know any better because you're used to it. We find the optimal position that you should have always had, coordinate it with the jaw joints, and we snap something in your mouth called jaw track that tests it.
Okay.
You get to test this. If you tell me I feel better, I'm sleeping better, I have less headaches, my neck pain's gone, I love the new shape to my face, I love my new jawline, let's move forward to the next phase. Well, the next phase are VenLay restorations, and what we're doing there is we're building now the bite you should have had by adding high-tech porcelain to your teeth. And what I'm doing is I'm doing all 28 teeth at one time and three-dimensionally having them all close into your ideal jaw track, jaw position.
So that's what this, in the next picture you can see that. He has a bit of an underbite, is
overbite.
He has an overbite because his jaw is pushed back. So you have a recessive chin with an overbite. He has a narrow smile. He basically has porcelain veneers that didn't help him at all because it's just cosmetic. Right. It's not jaw position optimization. In the after picture, he has a masculine chiseled chin. He has a jawline now. He's biting his teeth together in both pictures.
Let's talk about somebody younger. Let's talk about a young woman who. Let's see, what did you do here?
Well, she has an overbite. Her jaw's pushed back. She has headaches every day. She hates her facial profile. That's the same jaw in both pictures. Took only 2 weeks. None of her teeth were ground down. No shots, no braces, no pain.
Okay, so that happened to me when I was a kid, and then I had braces to fix that, to get that jaw forward.
Yes.
How did you do that without braces in 2 weeks?
Well, basically, what they did with your braces was they tried to get your teeth lined up so that your chin could be in a better position.
Right.
What that does, what this facelift dentistry does, is it gets your chin in the best position. And once we locate that position, instead of trying to move your teeth or instead of grinding your teeth down, we add to your teeth. So your teeth could be worn down, you could be a senior citizen, you could be on multiple kinds of medications, and we can treat you versus sometimes you can't be.
So that's how you get it to last. Because my next question was, because our teeth, our mouth, our bones, everything's constantly moving. How do you get it to stay that way?
Great, that's a great question. I just want to bring out that you floss the same, you brush the same, you eat the same, they're not removable. Each tooth gets a custom handmade individual restoration that goes over the biting surface and the outside surface, so you can have that wide smile, you can have the right jaw position. You can have everything you've ever wanted without it getting crazy.
All right, and then the last thing I want to talk about is like a smile, because you know their smile is a signature of everyone, and sometimes because of your teeth, you don't feel comfortable smiling, and this gentleman was an example of that.
Well, what happens is that he has an underbite. Everybody with an underbite and most people with overbites that can't be handled with braces are being told they have to have jaw surgery. You don't have to have jaw surgery. He was looking at an underbite. He has a bilateral crossbite and his lower teeth are out in front of his upper teeth. He doesn't smile. He doesn't like smiling, so everybody thinks he's angry. He's not angry. He's a nice guy. And that's typical of older patients, but you would see now he has a comfortable smile.
Yeah.
He's now... And it was all built in just a matter of a couple of weeks, and he's a new man.
Now, is this expensive?
Well, it is expensive to most people because most people are used to getting just pieces of treatment. If you go and get braces, there's 8,000 or more. If you go and get jaw surgery, there's what, 30, 40, 50,000 more. Right. Then you still have short yellow teeth, and so you get porcelain veneers, and you still may not have the bite. And by the time you add that up, but instead of doing all of that, which takes 3 years, we can do the same thing in a few weeks.
And you have a result that lasts a lifetime. It's terrific
Well,
work.
I don't like to say that because we're living, I'm not sure my 20-year-old is going to have the same thing till they're 80.
Oh, yeah, you're right. You're right. We are living longer, but maybe not that long. Yeah.
Well, the point is they could, but I don't think so. I haven't seen that. I always say to my patients, you never know the technology we're going to have 20 years from now.
That's true.
And if you take all the VenLays off your teeth 20 years from now, guess what? You've had 20 years less wear.
Right,
Yeah.
right.
Yeah.
Well, Dr. Muslin, thank you so much for being here. We
You're welcome.
appreciate your time.
Great, interesting story. Thanks so much, Doctor.
You're welcome.